What is hidradenitis suppurativa and what can cause it? HS is a chronic inflammatory skin condition that shows up as lumps and bumps and cysts, often in areas such as the underarm, under the breast, or in the groin. It often starts from clogged hair follicles that can become infected and tends to flare up with inflammation and hormone fluctuation. It can really leave bad scarring, and it's hard to live with. The pain and discomfort in itself is a burden, but for me, for example, since it was really bad under my armpits, I didn't want to wear tank tops. So even at the gym, I always wear a shirt with sleeve, which is usually not my preference. So what can cause HS? There isn't one single cause, but common triggers are chronic inflammation, insulin resistance, hormonal changes, so hello perimenopause, and friction, sweat, and stress. For many women, HS is not random. It's your body waving a big red flag. So what is your body trying to tell you? And how can you manage HS? Well, one of the triggers was chronic inflammation. If your body is telling you that maybe HS comes from inflammation, it would be wise to cut inflammatory food, such as dairy and gluten, although they're not the only culprit. If insulin resistance may be the issue, you'd want to look at cutting your sugar intake and your carbohydrate intake. So a low-carb diet or a keto diet might be good options here. Now, what about friction, sweat, and stress? Well, you'd want to wear loose clothing to avoid friction. You might consider washing the sweaty area more often throughout the day. Maybe just wiping it with a cloth and soap. And you'd want to implement stress management techniques such as walking, breath work, Pilates, or something else that suits you. Now, let me just say, HS is not caused by poor hygiene. In order for me to manage my flare-ups, I'll sometimes wash my underarms twice a day or use post-workout wipes. These actions have helped me out. What about hormonal changes? Well, that's a tricky one. Perimenopause makes us more insulin resistant, and less estrogen often means more inflammation, and less progesterone also impacts your stress and your sweat. So all common triggers of HS. That's when you need to make several adjustments in your life and your diet to make sure that your body receives what it needs. In my next video, I share how HS showed up for me, what triggered it, and the one change I made that pretty much controlled my flare-up just in a couple of days. So if you're dealing with painful cysts, unexplained flare-ups, or feel like your body suddenly has changed in perimenopause, you won't want to miss it. See you there.